In this episode, I'm sitting down with Katie Boyce, a board certified patient advocate and consulting chemist who is dedicated to empowering the endo community. With a deep knowledge of biochemistry and a passion for patient advocacy around endometriosis, Katie breaks down complex scientific topics, dispels myths, and brings critical research to light. We'll dive into how she's found hope on her own endo journey and how she continues to fight for better understanding and support for all endo warriors. Join me for this inspiring conversation with Katie Boyce. Hi, everyone, and welcome back. I am with a very special guest today that I have been looking forward to speaking with for a long time. Her name is Katie Boyce. Katie, welcome.
Hi, thank you for having me.
Yeah, thank you for taking the time out to be here. This conversation is so important because you've been in the endometriosis space for a while now, and I want to give the audience a little background on what you've been doing before we kind of launch into this conversation. Katie is a board certified patient advocate, and she is a consulting chemist with her bachelor's in biochemistry. Love that. She dedicates her social media efforts to empowering and educating individuals impacted by endometriosis, which includes, and I think this is really important, and I'm sure we'll touch on this, breaking down myths, complex scientific topics and discussing those, up to date research, and controversies within the endometriosis community. She regularly consults with key opinion leaders, researchers, and surgeons in the field of endo to ensure the patient's perspective is present. There are several places that you can get in touch with Katie. One is endogirlblog.com and at Indo Girls Blog on Instagram. But we're going to put all this stuff in the show notes, so don't worry about that. But again, welcome, Katie, and thank you for being here.
Yeah, thank you.
So tell me a little bit about your history in terms of you have this amazing background in biochemistry, but you also have this passionate advocacy in endometriosis. How did those things intersect for you?
Well, you know, I feel like I always start with my endometriosis story is very much like most. We're really not all that unique. I know that might sound a little bit counterintuitive in a lot of ways, but I say that because I think it goes to show just how many there are of us who are struggling with this and still get left behind or
Mm.
ignored in so many ways. And we're all kind of screaming, right? We all have this very similar story. So, of course, my story with endometriosis started from a young age with pain that nobody could explain and kind of vague symptoms, a lot of, gastrointestinal symptoms. And my family, they were really relatively receptive and tried their best to, get me to different providers. And over time, just kind of found ways to manage and kind of just say that I guess this is my new normal. And of course, dealt with the period pain. And I got to a point though where I I just really wanted to live a normal life in some way. And I did pretty well in school, but college was a struggle. When I got to college, I didn't do that great. I ended up dropping out of my first university. I didn't go back till later. It was hard. And I had to start back out at a junior college where I could kind of learn how to deal with my health while navigating and juggling school. So I felt like I finally got that under control when I finished my associate's degree, and I'd gone back and I fell in love with biology of all things. And I said, okay, I think this is what I want to do. And I had to take some chemistry courses, of course. I was terrified, but I got really fortunate. I had this amazing professor who really sparked an interest in this for me. So that is what started my journey into biochemistry. I moved on to university, and I really just thought, I've got to find a way to balance the two. It was hard. I at one point did have to get access services through my university to basically have a note that said, I'm having these symptoms today. I'm not going to be able to come to class. Fortunately, it was a primary care physician that helped me with that during this entire time. I did not have an OBGYN that was really understanding. And
Mm.
because of him, he really helped me get through that time. And of course, being a doctor, he really encouraged me, do what you can to get through this degree. And I even had a biochemistry professor one time saw me in the bathroom, and she told me, painful periods are not a reason to miss class. And because I was
Oh
in there
my.
sick, I was obviously at school, but I was unable to make it through that class. And so that day, at that point, it just kind of became this thing where I was angry.
Mm.
I was angry. And by this time, I did have a diagnosis of endometriosis. And I, to access the care I needed, it was expensive. I had to travel, and I really just buckled down and did what I could to graduate. And then once I was able to graduate, I then was able to access my care finally. But I really wasn't thinking of advocacy at that time. I was thinking I'm going to have this surgery and I'm going to move on. Unfortunately, with endometriosis, it doesn't always work that way. I had a lot more to address, but it all came full circle when my grandfather got sick, and I ended up having to help navigate that process. And I realized that patient advocacy was a huge passion of mine at that point. I started seeing so many flaws and gaps in the system. And so
Yeah.
I was helping my family look through medication and applying that biochemistry knowledge at that point with his care. And, after that situation, I was like, how am I going to incorporate all of this? And that's when I decided to become a board certified patient advocate.
Awesome. Tell me about some of the gaps from your very unique perspective. What are some of the gaps that you perceived as you were going through the process to get a diagnosis?
First and foremost, I think during this time, so it was the late 2010s. There's been a big shift since then. And during this time, I never even heard the word endometriosis. Painful periods were definitely, and I know they still are, downplayed. But back then, there wasn't the Oralisa that we see today or the drugs that are marketed toward endometriosis. So there wasn't really a discussion of that when you went to an OBGYN.
Mhm.
And even when I had my first horrible episode that put me in the ER, I had passed out in my grandparents' bathroom. So my grandpa rushed me to the ER. And after that episode, I'm there and they say everything's normal. So they just send me home and say, follow up with your OBGYN. And of course I follow up and they're like, well, everything looked fine. We
Yeah.
don't know. And if you're not going to be on birth control, then there's nothing we can do. Birth control didn't work for me. I actually developed supraventricular tachycardia when I tried birth control. I tried a
Mm.
few different kinds of birth control. And so it just wasn't in the cards for me. And I didn't have any options. So, and they were not, and surgery was definitely off the table then. They were like, you're young, there's nothing wrong with you. I was told that because I had had presumptive IBS since a child, that I had had an episode of a painful bowel movement that had caused me to pass out and seize, and that's what sent me to the ER. I still have the notes from that OBGYN that says that.
Wow.
So that episode is actually what encouraged me to find answers elsewhere. And I was bartending at the time. And this is one of those huge gaps in care. Instead of an OBGYN or someone on the front lines referring me to someone who may be able to help me, I'm at work bartending, and one of my regulars says they were all up to speed on it because I'd missed work, or they could just tell the pain in my face. And we were chatting, and this one wonderful man told me, I know a really wonderful physician. He diagnosed me with a rare disease. Maybe you could see him. I said, okay. So I go, and yes, he's just an internal medicine doctor. He's an internist, but he also happened to be the physician for our local MLS team. And I was like, this is such a off. I don't know what I'm doing going to this guy, but I go, and I always call him my Dr. House because he wasn't like a real like soft, like empathetic type doctor, but he listened to me and he said, I think I know what's wrong. And he said, I think you have endometriosis. And I had never heard that word before.
Wow.
Yeah. And he said, unfortunately, you're young and no one's going to do surgery for it. And I'm like, why? How do you
Oh,
know this?
goodness.
He said, unless you tell them that you're worried about your fertility.
Well, he just told the truth. Yeah, that's a conversation that I've had so much with so many other people, that you're only considered worth being out of pain if you also want to have a child. Yeah.
There's that huge gap right there.
Hmm.
And
Yeah.
I don't want to blame any particular provider. I think it's a systemic thing, right?
Mhm.
And it's a thing
Definitely.
like they don't know how to treat the pain anyway. So why even go down that route, because
Mhm.
it's depressing for everybody involved. But, he coached me on that. And I went to another OBGYN and I did get my diagnosis. And so that was the validation, right?
Yeah.
And I had my little surgery. I say little because then, I thought, okay, I have my surgery and everything's going to be great now. And it wasn't, but it did encourage me to try something since I couldn't do birth control. I worked with a naturopathic doctor and I really thought, I could manage it that way. And I say that bought me some time, right? But again, these gaps in care, even my wonderful primary who helped me, get those services through university, and he would let me come into his office as needed to get shots of Toradol, anything he could do, but who was he going to refer me to? He
Mhm.
didn't know. There was nothing, and it was just, I thought to myself, how is this where we're at right now? Patients are not even being told about endometriosis back then. Some today still aren't. Pain doesn't matter unless you're worried about your fertility.
Mhm.
And and then on top of that, you go to different specialists and nobody coordinates care, right? It's all
True.
fractured. So you see
Mhm.
one doctor, you get a prescription, you see another, you get another prescription. Nobody's
Mhm.
cross-referencing, and it's very fractured.
So tell me what happened with that first surgery after, you go in, it's the when you said little surgery, describe that experience for you. What did they ended up doing? You did get an endo diagnosis. How did that come about? What did they do to actually address it? And what happened after?
So the OBGYN she was really, really kind. Obviously not like an endometriosis specialist by any means, but I appreciated her kindness, but it was definitely downplayed, right? This is just a routine laparoscopic procedure. I'm going to go in, I'm just going to look around in your pelvis and see if you have any endometriosis. And if I see any, I'll burn it out or I'll cut it out. Or she actually didn't say cut it out, I'll remove it.
Mm.
And I didn't know what any of that meant. I just knew, okay, whatever. We're going in. She knows what she's talking about. It'll be great. So it was about like a 30-minute in and out. For her, I was in a little bit longer, but I was discharged same day. I went home within a couple hours. A friend of mine came over. We went and had Panera. It was just so downplayed. I was very drugged up. That's the only reason I could go do these things.
Yeah.
And then I didn't find out till, later that because I had been so out of it, my sister had been told, yes, she has endometriosis. But it wasn't until later I got these really funny, horrible black and white grainy pictures that were like, oh, here was some endo here. She did fulgurate, so she didn't just straight up burn. She did attempt to remove it in a little bit better way. But she said there were like 3 spots. And I was like, oh, okay, great. This is awesome. And then I was in organic chemistry at the time. And I remember I had a lab like a week and a half later and just having some post-op like bleeding. And I remember being in college and calling the doctor's office and them saying, well, if it's not golf size clots or larger, don't worry about it. And it was interesting because I think that at that moment it shifted in my mind that, wait a minute, I think I had a major surgery of some kind. And I'm trying to navigate once again school
Mhm.
and this being told that it's not a big deal and not understanding any of it. I was just told, well, you can take this progestin, you can try this since it's not anything like the birth controls you've tried before. Give that a shot. But she made it seem very, this is what you do. And I was told if I wanted to get pregnant, that was the time. I was in
Mhm.
my early 20s. I was in a horrible relationship and I was still being told, this is what you do. And it was just that experience. I look back on that and I think if anything, I was so just overjoyed with validation that the reality
Yeah.
wasn't setting in.
Yeah. And they weren't speaking about it with all the um I'm not sure what year that was, but they're also not speaking about it in the full context of the way it needed to be addressed or addressing it surgically the way we know now that it needs to be addressed.
Right,
So,
right.
yeah.
It was 3.5 years later when I finally had my more legitimate surgery for it. And unless my disease No, my disease had not spread or changed that much in the 3.5 years. I just know that she hadn't looked outside of
Right.
the, immediate area around my uterus, because the symptoms had been the same all along.
Right. And then continued probably after. And in some cases, they can get worse. In some cases, they don't change after something like an ablation,
Mhm.
um, which is hopefully, if you've not listened to any other podcast, about endometriosis, ablation, just to be clear, is not the gold standard for endometriosis. It is excision. And so if you've been to an OBGYN, and they have talked about addressing endometriosis, one of the very first questions to ask is how often do they deal with it and how do they approach it before you end up spending a lot of money, a lot of time recuperating, and they don't actually take care of the issue. Yeah. So, what was the time of, your first symptom to the time of that actual initial diagnosis? How many years passed by?
I think it was around 15,
15 years.
because my symptoms started when I was in about third grade, a lot of gastrointestinal. And then by the time I was in fifth grade, I had started my period. And then my period started, it wasn't horrific yet, but I had always had the gastrointestinal symptoms. And
Hmm.
I had those gastrointestinal symptoms until I had the endometriosis around my bowel cut out. So obviously that was the connection there. It was, my dad has always been into alternative medicine and holistic health. And I remember, like, we put a whole home, like, water filtration system in the house, and I did all sorts of things um, to appease my father, as a child, to try to get well. And unfortunately, none of those things could cut out the endometriosis that needed to be cut out. Right. And so I think, and they kind of waxed and waned. I was diagnosed, of course, with unspecified autoimmune disease, just so many bizarre symptoms that get overlooked that endometriosis absolutely can cause just from its inflammatory response in the body. Things were overlooked. My extreme fatigue, like, oh, you seem like you have mono, but you don't. This is weird. It just,
Hmm.
my childhood was plagued with so many things like that. UTIs, constant UTIs. But it got to the point where, were they UTIs? This was the 90s. They were just throwing antibiotics at me no
They
matter
sure
what.
were. Yeah.
That's what they did then. It was like, turns
Hmm.
out I had endometriosis on my bladder.
Yeah, let's talk about that for a second because I think for the listener in other podcasts, and I want to reiterate in this one as well, in other episodes, we make sure we iterate that endometriosis is not just a reproductive organ disease. It's not just a disease of the reproductive organs, that it can be in multiple places. And the bladder, the bowel, are some of those. So when they finally got to the excision, where was it? Where was the endo? Where wasn't the endo?
Where wasn't? I was fortunate that it wasn't actually on my diaphragm. I do that
That's
because
good.
that's the diaphragm shape. It
Yeah.
wasn't actually there, but I mean, it was all throughout the pelvis. Um, I had an endometrioma on my right ovary. I
Mm.
actually had an endometrioma in my behind my uterus that was not even connected to my ovary anymore.
Oh, wow.
So this is might be vulgar, but I call that area the trash can because it's just like they always find so much endo back there, like in every, endo,
Hmm.
scar tissue. I had an endometrioma back there. My bowels, my appendix looked fine. It looked okay. It was a little bit suspicious. It's common for the appendix to be affected. My
Hmm.
bladder, pelvic sidewalls, all the way up to the diaphragm, but not on the
But
diaphragm.
not on it.
Hmm.
Did you ever have painful breathing as a result of it being close to
It's
there?
hard to tell because
Okay.
of my supraventricular tachycardia diagnosis and also asthma. So for me, it was like
Right.
I would get the side pain, the sharp side pain, but so much of that doctors and everyone would tell me that's just something that can happen with asthma or supraventricular tachycardia, the costochondritis, like the sharp pain.
Hmm.
They'd be like, oh,
Hmm.
that just happens too. I can't tell you how many EKGs and cardiologist I went to for those symptoms. So it's hard to tell, right?
Yeah.
Yes, those things have actually, now that we're talking about it, I've never had some of those symptoms since.
That's what
Um,
I was wondering,
I was like,
how
wait a
you're
minute. It's funny because even I used to have to get steroid injections for the joint pain I had. So that's a part of the autoimmune diagnosis that they were like, is it like a rheumatoid thing going on, or is it a lupus thing? But my joint pain went away after my excision also. So, and that
that's important.
joint pain was in my hands. So I don't know, right? Like anecdotal, but all I know is that I went from needing a steroid injection for joint pain in my hand to not.
Right. And with the inflammatory process, just to explain a little bit, for everyone's benefit, is the constant inflammatory process that endometriosis just it's constantly it's pervasive and persistive, that there's always some kind of inflammation going on. So it does make sense that you would have pain in far reaching areas that you can't really make sense of, that could potentially then, when it's removed, go away, as in your case it did.
Right. I'm sure there could be arguments otherwise, but at the same time, and I just know this from research and knowledge, the human body is so much more complex than,
Mhm.
than we can really put down and say, oh, and every wonderful doctor I've ever had, the good ones say it's possible. The good
Mhm.
ones always say that. The ones that, aren't as good, they have less humility and they tend to say, oh no, there's no way. But whenever I've had the honor and, privilege, either as an advocate to talk with phenomenal doctors or as a patient work with these phenomenal doctors, it's always, we don't know.
Yeah. Well, and another important thing is too, while looking at the gut microbiome and carefully attending to diet and lifestyle choices, sleep and things like that, isn't going to cure it. It also can end up, mitigating and managing, obviously not, again, not curing, but certainly not hurting, and definitely can help in terms of how we view management of the disease. What I mean by that is, we're not even sure currently, if you look at the literature, which you also read, I know, um, how lesions on the bowel at any point, in the bowel, are going to impact the gut microbiome. And of course, when the gut microbiome is then impacted, you have everything from stress management and mood regulation and impacted, everything upstream and downstream, which of course can contribute to inflammation in and of itself. So there's so many variables that can contribute to, for example, someone having musculoskeletal pain, pain in their joints or pain otherwise. So we're on the other side of the excision now, and with your you probably had to develop some incredible strategies for coping with the emotional stress or the pain caused not just by endometriosis, but also by the medical gaslighting, whether um, overt or covert, or however you want to describe it, that happens in that 15-year span, right? That long span of the wait for you. What are some of the things that helped you the most in terms of coping with that, strategy wise?
So I think it's very important that I share that a lot of my coping was with alcohol. I,
Mm.
an alcoholic, that became probably at its worst when I was about 22. Um, and I didn't know how to appropriately handle it. And there was a lot of anger, full of
Naturally.
rage. During this
Yeah.
time, I also was diagnosed with bipolar.
Hmm.
And um, so I'm navigating that as well. Fortunately, with that diagnosis, thanks to, again, that internal medicine doctor, he referred me to a wonderful neuropsych. I got my diagnosis, and then I got with a great psychiatrist and, most importantly, a therapist, a counselor.
Yeah. Yeah.
And she was the first person who really was able to help me manage and cope with a lot of that anger. She was like a 4-time cancer survivor, so she really
Wow.
understood what it meant.
Yeah.
And she was into some things that were a little bit weird to me at the time, like meditation. But I said, okay, I'll try it. You know, she always approached it from a science perspective, which she knew I needed. So she helped me so much during that time. But also for me, I got sober, and my sobriety group was another huge part of that, because there's so much embedded anger, and resentment. My resentment for the medical community was literally, I would say, in a lot, it was destroying me in many ways worse than endometriosis was, because of the way that I was
Wow.
trying to cope, right? With
Yeah.
the rage, the anger, the alcohol, the constant, I'm going to do this to show them, right?
Mm.
This need to want to make them all suffer, and for the way I had suffered. And
Yeah.
fortunately, years and years and years of, I'm coming on 10 years of sobriety, and
Congratulations.
thank you. And,
Yeah.
a few different therapists now as life goes on and I move and whatnot. And fortunately, that has given me a lot of the tools. But a lot of that I had to do on my own and get there on my own. And today it still rears its ugly head sometimes, every once in a while, because it's so deeply rooted. It was so painful that to this day, I actually, for my own mental health, I can't go to an OBGYN. I
Mm.
can't go to an OBGYN office. I tried. I did surgical device sales for a little bit, and I would have, I mean, I'm medicated, I go to therapy, and I would still have a physiological stress response if I walked into an OBGYN office.
That's
And
powerful.
yeah, it's rage, it's anger, and it's being scared.
Hmm.
So I do my best as an advocate to let patients know if they're the same way. Obviously, I'm not a mental health professional. Find, see who you can work with, but I also reassure patients that it's okay to find a provider. There are primary care providers out there and family physicians who can do those exams for you. You don't have to go to the OBGYN, because if you have
That's
that
right.
kind of deeply rooted trauma, you know, I so it's like I've overcome all of these things, and I'm so proud of that, but I get taken right back just by going into an OBGYN office.
The incredible amount of just like inner wisdom that you have built, resilience that you've gleaned from that entire experience is like, I just want to stop and go, that's amazing. That's amazing that you have made that journey. And that kind of, I don't even want to say progress, because you were a wonderful whole person then and you're a wonderful whole person now. It's just that you had to deal with all of these variables in between that weren't your fault. You didn't just obtain endometriosis on the street corner somewhere, or eat the wrong thing or not sleep enough or do
Right.
whatever. And we know of all those, those theories that have been debunked now. I mean, it is what it is. It's there, when we're born. So I just want to applaud and congratulate and just say that's amazing that you have made this a lifetime's journey. It feels like in just a few years, really.
Yeah, it's a lot. But I really mostly share that so that others who may be struggling the same way aren't as
Yeah.
ashamed. I've met quite a
Hmm.
few who do utilize alcohol as a coping mechanism, and I want to tell everybody that you're not alone. It's okay. You're not inherently bad for that.
Yeah.
You've been dealt, a bad hand, but
Hmm.
we can work through it. And I worked through it my way, and I know everyone works through it their own way, but I guess the way to put it is I'm just trying to destigmatize. you
Hmm.
know yeah, there are people out there who did find ways to cope. Good for them. They ate well, they did their yoga, they did all the right things. No, I was not that person. And it's okay if the other people aren't either. I
Yeah.
was hanging out in rundown dive bars. That was my thing. And so I like people to know that it's okay. It's hard when, especially in the endometriosis community, we're surrounded with a lot of the wellness community,
Hmm.
wellness culture, and it can be unrelatable for a lot of people. I might be in this in between, because those things can be really expensive or
Right. That's the,
unattainable.
yeah. When you said unrelatable, the first word that popped into my mind with some of the just take care of yourself was inaccessible,
Mm-hmm.
and unaffordable to a lot of people.
Yeah.
And so
And
bringing this information directly to them to just be able to say, if the GYN is your gynecologist, if your GYN is triggering, because that's what you're describing essentially, is everyone has those triggers
mm-hmm.
just across a spectrum, then yeah, go see your PCP, go to a nurse practitioner, you could see a PA, you could just in a general practice. Um, there are so many different ways to approach it. Same thing with mental health, talking about the emotional and psychological and spiritual load. There are so many different mental health directions that you can go. I'm not sure if is not even a question that I had planned to ask, but there's so many different approaches, whether it is cognitive behavioral therapy or acceptance and commitment, ACT therapy, or EMDR, eye movement desensitization, hypnosis. Like, people find so many different types of therapy beneficial, even combined with some of the mindfulness, some of the meditation, that kind of thing. What really ended up resonating with you?
So this, for me, can get a little bit complicated. Mostly because I always am afraid it might be controversial for some people. But for me, it really was doing a 12-step program. So
Ah, yeah.
for me, I was doing CBT was my
Hmm.
main, what I did with my counselor, and it was brilliant. That helped mostly with tools, right? That provided me with a lot of tools for working through the moment, or planning, and a lot of managing. But
Hmm.
my 12-step program, that's what really helped me with that spiritual component that I was not. I was self-proclaimed very loud atheist up until this point. And that was hard for me, right? A lot of anger
Yeah.
there,
Yeah.
in a spiritual sense. So that helped me. And I worked with, you have a sponsor in these 12-step programs. And so I had a sponsor, and we worked through a lot of that. And she was very much what I needed during that time, of somebody who had also been there, different life circumstances when it came to health, but also not able to cope with life. And never judged me for any of the things I had done. So it gave me an opportunity to, whereas my relationship with my counselor, I would share things with her, but we know, just like in endometriosis world, being able to share with somebody who can relate is
Hmm.
very powerful. And so I was able to share my deepest, darkest with an individual who just sat across from me, didn't even flinch. Things that I thought were just horrific, and she's like, yeah. And I'm like, so I provide, and that is one
Yeah.
thing that I try to provide today for others, right? There's
Yeah.
nothing you're going to tell me that, if we're trying to find you a provider, or we need to talk about your medical history, there's nothing you're going to tell me that's I'm going to flinch. But she helped me with that. And so then I began to trust another human, right? And then we went through a lot of my resentments. And that isn't something that I had done in therapy. So in these programs, there's a lot of writing out. I actually had to write out, what are people or institutions or thoughts, like schools of thought, that make you angry? And believe
Oh,
me, a lot of it had to do with the medical, right? And it was like, all
wow.
right, list
Yeah.
them out. And then another column was, what did they do to you? Write it out. But then there was this third column. It was like, what was your part in it? And I was like, wait a minute. Okay. Wait a minute. Okay. Wait. And then I took a step back, and I was able at that point to say, take a look at a bigger picture here. If I didn't like the way I'd handled something, how could I have changed that so that, in the future going forward, I can be a person who's not full of that rage and anger. And instead of letting that monster, those thoughts and that rage feeds that. Um, and if I can not engage in that, or if I can starve those thoughts, then I
Mm-hmm.
can have a more peaceful life. And I know that might sound a little bit convoluted, but I had to get out of a state of it just eating me alive.
Yeah.
And so my cognitive behavioral therapy gave me a lot of those important skills that I needed, like how to take action. But my program that I did in getting sober is what helped me really come to this spiritual, more peaceful place. No, I am not a saint by any means. But now what I try to do are I try to, you know, engage in behaviors that aren't going to make me feel bad, right? Or
Mm-hmm.
engage in behaviors that I will regret, because I don't want to let that rage against the medical machine
Yeah.
rule me anymore. I feel like one of the greatest things I can do on the other side of this with all that medical trauma is to move above it in any way I can. And so
Mm-hmm.
whenever I'm talking to somebody else about it, I don't ever try to, impose how I did it. But I like people to see, I went from a person who was like adamantly atheist, there's no way, there's no spiritual anything out there, to that's what I had to do, you know? I wasn't really open minded to it at first, but that's what I needed to do to heal. And so whenever I talk to somebody, I don't care what somebody needs to do, you know, I will always encourage anybody to do what they need to do to get to that point where you have an improved quality of life, ultimately, right? We
Yeah.
can we can live, day to day. It's not perfect, but also that wonderful physician I had, he told me one time, he said, I don't care if putting a paper bag over your head makes you feel better. He said, I won't judge you for it. He's like, as long as you're not harming yourself or somebody else, I'm not going to judge you for whatever you're doing at home that brings you, an improved quality of life and joy. And I like to take that to heart as well, because I know that it can be easy to judge others and the way they're doing things, especially when you get to a point where you're starting to feel well. I see a lot of people want to take what they've done and tell everybody that this is
Do the
what you need to
same.
do now. I see it all the
Yeah.
time with coaching and selling and diets and
Oh,
everything.
there's
And
a lot of that out there.
there is. And
Yeah.
I get that because I know how exciting it is to
Mm-hmm.
finally, have your epiphany. But I've learned that it's more important for people to find it on their own, what works for them.
Yeah. I think that's a great summary statement. I mean, when you started to tell me the way that what your strategies and what your coping was, I just saw your face. For those of you not watching the video, I'll just tell you, I saw Katie's whole face and um, just kind of dimension just shift. There was like, you were even brighter and more sparkly than you were before. It was like it just shifted and changed. And what you were describing with that anger and the rage, it reminded me of something from, some of you may be familiar with internal family systems, or IFS, where that person would be like the firefighter, like the manager, the person that comes out and is like, I got this, I'm going to handle this. But the firefighter doesn't always handle it in the best way,
Yep.
right? And we all have a firefighter,
Yep.
right? We also have a little inner child too that would get quiet and smaller, and I think that's oftentimes how we end up feeling in the healthcare system when we have institutional betrayal, or what I've heard called institutional betrayal, where the place that you go to be safe is the place where you're harmed.
Mm-hmm.
That's a massive betrayal. That's as big as betrayal in an intimate relationship, et cetera, right? It's huge. And to be able just to identify that if you're feeling these things, if you're feeling the anger, you're feeling the rage, that we're not condemning any of those feelings. They're all really good. They are catalysts to get you to another place, right?
Mm-hmm.
If we didn't have them, that would be a whole other issue, right? It might be more of the depressive side of things where you feel stagnant and stuck and you can't move past. But the firefighter is there for a reason. And so I just want to encourage everyone, that if you're listening to this and you're struggling with endometriosis, or you think you may be, to embrace those things, and to know that they're, like Katie, like you're saying, there's dozens of different pathways to get to the other side. And I just thank you for sharing that unique story, because we hear of all of the typical pathways, which is the ones I started out listing to, right? We hear of all those typical pathways. And I think 12 steps, which I've heard of used in many different capacities,
Mm-hmm.
beyond just, alcohol, issues, to be really super helpful, relationally, like socially, being able to move forward in the way that then feels like you,
Mm-hmm.
instead of the firefighter you, right?
Yeah, exactly. I didn't know there was this other component to me that could be a good friend. There was empathy sometimes deep down inside that I didn't know was there. And I also like to share with people, because a lot of the 12 step can be scary because there's a God component. People feel like there's a God component. And I always make sure people know, if it's something that you're interested in pursuing, there are agnostic groups, there are atheist groups, there's all sorts of inclusive groups now, for those 12 step programs, because they have been found to be super effective in a lot of ways. So I'm glad that it was taken and expanded so it was more accessible. And another
Yeah.
thing I like is that it's free, right? And they're in
Yeah.
all parts of the city. They're not in just the affluent areas. They're not just in the other areas that maybe, I know I've met people who are like, I'm afraid to go to that area. That's okay. They're all over usually, and it's a free resource.
Yeah.
So it's just something that I like to put out there, because a lot of people don't know that there's an option now for it to be, agnostic or atheist or something along those lines. So I'm like, it's a free resource, because not everyone can afford. I know mental health, unfortunately, can be
Super.
expensive.
Yeah, it's super expensive, especially as insurance decides they're going to cover less and less,
Hmm.
which is also a problem in endometriosis too.
Right. Yeah.
So, yeah, I mean, that's a whole other area we could like um, raise the curtain on and discuss. But I think that in terms of what I'm curious about, because I have like a blue million questions here that we will never get through, but
We can try.
I wanted to ask, in terms of like what changes, because I don't want to speak for everyone with endometriosis, but I can probably, as a person who's been through it, you've probably more likely than not experienced a institutional betrayal where the place you went to get help didn't help you, or medical gaslighting where they just dismissed you, marginalized you, shamed you, or in some way made it a whole lot worse, and then ignored you and didn't give you the care you need. So I think more of us than not have experienced that. So what, in your ideal world, how would you like to see the medical community approach, diagnosing, treating? How should they be approaching into people with endometriosis?
So ideally, that initial provider that somebody goes to, right? So say, if you were young like me and you're presenting with these gastrointestinal symptoms that nobody can figure out, right? They're vague symptoms or symptoms that get worse, at some point in the menstrual cycle, not just on your period, but maybe with ovulation or any other point in the cycle. If there's like a cyclic thing occurring, at a young age, and ideally, in the perfect world, you would go to your primary care physician, even a pediatrician, and they would say, this sounds like it could be endometriosis because everything else is coming back normal, right?
Mm-hmm.
Um, so at that point, in a perfect world, we would have a referral system for surgeons who are very familiar with endometriosis. And I know surgery, or saying surgeon, can sound like, oh, we're going to rush into surgery. That's not the case, right? We do the same thing. If you think you have a back condition, you're going to go to an orthopedic surgeon, right? Doesn't mean you're going to have surgery right away. We're going to investigate what's going on further. And I feel that way. It should be that way for endometriosis or anybody presenting with these vague symptoms that nobody can seem to figure out. Ideally, an endometriosis surgeon who is familiar with the ever-changing, better technology and imaging we have now, right?
Mm-hmm.
Or even just doing exams, physical exams. Sometimes they can feel nodules. They know what to look for, what to feel for. Even, if it's a patient who's comfortable with it, a transvaginal ultrasound. But providers who have the expertise in endometriosis to know what to look for, right? That can be indicative of it. And then, because we don't need to be doing unnecessary diagnostic surgeries, right? Where they just go in and look and maybe burn what they see. That's not helpful for anybody. So ideally at that point, then they have surgery to get it removed before the disease has the chance to spread, or
Right.
progress, or cause debilitating symptoms that should never be addressed, right? Or
Yeah.
again, maybe that patient doesn't want surgery. They could be offered, of course, any other medical treatment. Ideally, one day, maybe we'll have a hormonal option, but as it stands, we currently do not. But I feel like that's the trajectory it should go. It should not be bouncing around to all these different doctors and bouncing around to different specialists, right? We've got all these different symptoms that I see, and I see this a lot when I'm working with somebody as their advocate. They'll have like 5 different specialists because they think they have 5 different conditions. And while
Mm-hmm.
I'm not a physician, we can typically take a step back and a look at this and say, what could be crossing over here, right? And a lot of the times, like I was mentioning earlier, there are side effects from certain medications that are actually causing a new symptom. So ideally, we can consolidate that so the care is less fractured, right? And
Right.
then,
Yeah.
and
Because that's one of the biggest problems is time of first symptom or sign to time of actual diagnosis can easily take a decade, and it shouldn't. And you mentioned another really important verb, which is spread. You know, endometriosis is, of course, not cancer, but it acts like it in that it spreads and it can impact so many different organs, um, all the way up to the respiratory diaphragm, into the lymph nodes, et cetera. And the earlier we can intervene, and I think in the world of healthcare overall, I think early intervention is one of the most important phrases that we can be using. Early intervention is catching it early, taking care of it so that women can go on to not have to live in survival mode for the next 5, 10, 15, 20, 25 years. They can move on to thriving mode and get all the follow-up care that they need to. Yeah.
absolutely. I think I do like to sometimes point out a lot of people when they hear spread, they do get afraid that it can just like get in the bloodstream and spread, similar to cancer. And I always tell it doesn't metastasize the same way,
Mm-hmm.
right? So, we just don't know. Maybe there's endometriosis in a part of our body that just hadn't presented symptoms yet, but can later, right? But the progression, people get a lot of people ask me about that. How does it progress? And like, well, it's actually it's a process where it's basically the best way to put it, is it's a constant inflammatory damage repair response. And as that happens, it can just, greater and greater tissue damage throughout wherever it's occurring. And so
Right. Right.
it's,
Even if it's not a lesion, um, it can lesions love to spur and adhesions and creating scar tissue. So you end up with secondary scar tissue issues, which can
oh yeah,
be in various areas of the thoracic, up into the chest, for those of you not in healthcare, and also down into the abdominal and pelvic cavity. But the good thing is we can have very good outcomes with skilled excision and prehab and post-op rehab. There's so much that can be done. It's an exciting time to, be alive right now versus even 10, 15, 20 years ago when we didn't have what we have now. So it is a hopeful message overall.
it is, right. And like I was saying, with imaging improving, there's better planning, right, before going in to surgery.
Right. Yeah.
Looking.
Yeah. We hope that the trajectory of imaging and where it can go in terms of helping with surgical planning, and even in the future, perhaps even diagnostic, capability is immeasurable right now. So it's a very exciting time. It's a very hopeful time. And what is some advice? Like this is a good closer question. I think is what are some of the advice that you would offer someone who's recently been diagnosed, or maybe actually seeking diagnosis? Because I think that maybe the latter is where a lot of women are, is like they're not sure. What would you say?
My first thing I always say is, have we been tracking, right? Have we been paying attention and kind of journaling, what are the symptoms? And impact on quality of life, just because most importantly, when you decide to take the step of looking for a provider, that can be really invaluable data. and we forget a lot of what we experience on the day to day. So I feel like it's important to, keep track of that in any way that we can, whether that's just like a quick note on your phone, or some people do like to write it out. But then, something I often say is don't panic. I know a lot of the times it gets really, really, really scary to go down some of these really horrible holes. Yes, endometriosis is very serious. There can be very serious complications, but we also need to take a step back and look at it from the best we can, a non-emotional way of, okay, what is my plan going to be for this? And ideally it would be, let's just find the closest expert, let's look through my insurance and see who's in network and where can I go. Unfortunately, we can't do that with endo. So a lot of the times it's who, who's accessible to us. And I know everyone's always saying, don't Google your disease, or don't use the internet. Unfortunately, with endometriosis, we really have to utilize those resources. Yeah. So something I say is, look for maybe a local group if you can, but go in to any like social media group or platform, go in knowing that there's going to be maybe something that's traumatic or triggering. So there are going to be stories that might be hard, but they can also be a really great resource for finding providers who are familiar with endometriosis, right? So if that's a headspace someone's able to be in, go in there, at least, look for, like, search the group for words for, providers or OBGYNs or something. And if you're looking for that diagnosis, because there's the off chance that, no, we don't really have like a specified endometriosis specialist. I guess, like, it's hard to say what that is, because there's not a board certification for being an endometriosis surgeon. So it's kind of Wild West out there. So a lot of the times what I suggest is, I've got, like, on my blog, or even a free endometriosis course that I made with a friend, questions to ask. So if you're seeking that diagnosis, there's some questions that you can ask when you go in. Be like, these are the symptoms I'm experiencing. These are cyclic. These other ones aren't cyclic. And, would you, if I think it's endometriosis, how do you go about that? Some will say, well, surgery. Some will say, well, let's do an imaging protocol. And some will say, let's just try birth control and see if your symptoms go away, right? Ultimately, that's going to be on the patient to decide. But I want patients to know going into that, if you don't want birth control and they are pushing you, that it's okay to find a different provider, right? That's my advice, right? Because there are so many unknowns with endometriosis, I like patients to understand that, yes, you are speaking to the doctor, but there is no such thing as, like, an all-knowing individual in endometriosis. So your desire, like what you want, matters. And there's nothing wrong if you're not okay with their plan of action. So if you're going in, any physician that's pressuring a certain treatment, it's okay to say no and go elsewhere. I think that's the most important thing I try to get across, is that it's informed consent across the board. And that means you are being given multiple options and the ability to go home and look through those options for yourself, and try to do so in a way that's very systematic. So a lot of, I like to do, like, either Venn diagrams or columns when I'm working with someone trying to make their decision. And because I want to tell everybody, let's find an expert surgeon that's going, that's got an exorbitant amount of experience in this, and they're going to be able to cut out your disease and be done. Unfortunately, we've got accessibility to consider. We've got financial barriers to consider. So it's really just a sitting down and making a list and seeing which providers we can get to, and then what options they're presenting. And I think something that is important to remember, and I'm sure everyone, if they've listened to your podcast, I know Heather Guidone, she was the first person to really remind me that doing nothing can be an option. So yes, that can be really scary with endometriosis. But if you can find a provider who's willing to monitor, keep up with you, keep up on, making sure your bowel function's okay, kidney function's a big one with endo, just kind of keeping an eye on things. If you're not ready for any of the options that have been given to you, that's okay, right? And so I just like patients to know that you don't have to rush into a diagnostic surgery, because we know that doing surgery with someone who's not necessarily skilled in endometriosis can potentially cause more damage in the long run. So I like
Mm-hmm.
patients to be able to, that's that don't panic, right? Let's hang up, take a deep breath, and let's make a plan here so we're not rushing into something that could potentially make it worse.
Yeah, absolutely. To know that there's to obviously I mean the word that comes to my brain is always empowerment, that you always have options, that you're in charge, that you can hire and fire your healthcare providers, and then that power rests with you is important. If I can ask one more question, I have one more question. How maybe what is a better way to put it? What have you learned about yourself through your experience with endometriosis, do you think?
So I've learned that I'm that, as you mentioned earlier, that firefighter. I've learned that when it comes to being an advocate, that does not mean taking what I've done and saying that this is the way it needs to be done.
Mm-hmm.
And I am learning every time I work with somebody new from a different background, different life experiences. I am always learning that even more in depth than I knew before. That there are so many nuances and variables to each person's story and situation that I can't stand on my soapbox and just say, this is the way you need to address your endometriosis. And I've learned that true advocacy is me listening and then helping them based on what the information is that they're providing me, then taking that and finding the information that they may not have access to, providing that for them. That is an advocate speaking for them, right? But only what they want me to say. Doing, I offer, and then I let them tell me what they're comfortable with. When I started this, I thought advocacy meant I'm going to scream from the rooftops and this is what I'm going to say. And I want everyone to do it this way because this is the right way. That's how I started. And there's a lot of growth in that. And this, journey has taught me, this journey has been very humbling, right? Like I was saying, you get to the point where you're so excited that you finally found something that worked for you and then you want everyone to do it. I guess it's definitely been the humility part of it. But that makes me a better advocate and it makes me a better friend. Being able to remove myself. It's so hard to do that for me because I'm that, like you said, I'm that one that wants to rush in and take charge. I want to do it. And I've had to learn. I will point blank say, if somebody comes to me and they're in a certain situation, I'll say, do you want me to listen as your advocate, or do you want me to give action items as your advocate right now? Because you have to tell me, otherwise I'll just go into action. And I know that might not be the best thing you need to hear right now. So that's what I've had to
Because
learn.
sometimes we have to share our story with someone or hear that story, and we need to cycle through it 2 or 3 times or 12 or 24 times before then we realize, oh, I am now ready to take that action step. So I think that's a really wise thing that that you've developed, through this kind of whole universe of resilience that is unique to endometriosis, right? It's kind of like the grit. You've got resilience and grace and empathy and tenacity and all those things. We could just about turn that into an acronym for endo. It's uniquely, it's uniquely all its own. There's a particular grit about women who've had endo and have gotten to kind of quote the other side of that. So tell everybody where they can find you. Speaking of advocacy.
Yeah, well, thank you. So the easiest way to access me is through Instagram, at Endo Girls Blog. For just general information, endogirlblog.com or Endo Girls Blog, either one will direct you there. I also am listed for my advocacy services as a board certified patient advocate. I am on, I think like Greater National Advocates website, GNAW and NAHAC. I can be found there. And also, I'm not very active on Facebook, so I really try to let people know that because I'll realize that I have missed messages there. But definitely Instagram is the easiest
Is the
way,
go.
and that's where I put a lot of the most of my educational information.
Okay, awesome. And we will also put links to your resources and how everyone can contact you in the show notes.
Thank you.
Katie, thank you so much for being here, for sharing the time, for like braving these decades and then just being so open and transparent and sharing. I appreciate it.
Thank you for having me.